My name is Arya Shander, and I'm the Emeritus Chief, Department of Anesthesiology and Critical Care at Englewood Health, which is situated in Englewood, New Jersey, USA. So if I reflect on this conference, which is still ongoing, this is really exhilarating. There's no question about this. It's a mixture of speakers from different parts of the world, but again, mostly dominated, I think, by speakers from Malaysia. And seeing not just the enthusiasm, but seeing the level of knowledge, as well as the enthusiasm of transferring this knowledge to the audience is really just spectacular. I think that Malaysia clearly has the opportunity to be a leader in Southeast Asia or Asia altogether with patient blood management after seeing this conference. I can go on and on and on, but all I could say is that this has just been a wonderful experience. Well, I think that PBM is part of the global good care that we provide patients. It's one aspect of it which has to do with the patient's health, and mostly the patient's health and blood health. So patient blood management, what it does, I think in many ways, it personalizes care, but ultimately does the best thing for patients in terms of both their clinical outcomes, but also in terms of cost of healthcare, the reduction of cost of healthcare by doing everything right. I can go on again about PBM and its and all of its aspects, but the important part is that PBM provides clinicians with a way of improving patients' blood health. That's the ultimate goal. Well, the first thing that we need to do, which I think this conference does, and we have others who are working very hard to deliver the message to raise awareness in the general population. The public needs to know that there is a better way of treating them than just relying on transfusion. And it starts by them understanding their own blood health, if you will. So the way to do this is to get to the public, which is what we're doing. Once patients hear about this, we need to be able to give them resources if they're asking questions. It would be nice that every hospital would have some of the public outreach, if you will. But more importantly, it would be very nice if we can get to every clinician and every physician, because the door of any patients, the entry door of any patients to healthcare starts with seeing the doctor. And if that physician in their office would have information or themselves would be educated, they'd be able to, again, answer the patient's questions and also inform the patients of the existence of patient blood management. The idea is that if my colleagues don't know about patient blood management, I think I've heard this before, we need to ask them what is it that they know about patient blood management to start with. And also to review and examine their own practice, to understand that what they're doing today may not result in the best outcome for patients. So that will hopefully intrigue them to ask more questions and to learn about PBM. It's hard for me to believe that there are any physicians out there who don't know the existence of PBM. They may not be practicing it, but I would assume that they would have some idea of its existence. I think that, as I think others have heard me say this, keep going at it. This is not a one day of effort, 1 month or 1 year effort. This is a lifelong effort. And not only looking forward to, again, make sure that PBM progresses to everywhere, but we also need to look backwards at the newcomers and make sure that the newcomers are entering into healthcare as clinicians understand that this is the right way to care for patients.